start, I guess I'll have you introduce yourself again and
Sure.
what you do.
Okay. So I'm Dr. Terry Chase. I'm the Associate Professor of Nursing Mental Health in the BSN program at Colorado Mesa University in Grand Junction, Colorado.
Awesome, thank you. I guess just to start, like we've been through a crazy 9 months, and things right now are very different than when the pandemic first started. So, what do you think are the biggest changes that you've seen in the last 9 months of this experience?
Well, there's probably a lot. I think overall, I think we're just sort of like like we're in a pandemic now. We're just kind of motoring through it and it's become part of our everyday life. Mask wearing, the anticipation of vaccines, all of the grief and loss and sadness that goes along with not being able to do the things we used to do, as well as people have actually having lost friends and family. From a teaching perspective, I think that from my experience and my school's experience is that we're really concerned about clinical experiences for our students in facilities, because a number of facilities have actually shut us out from sending students. Some have stayed open, but there's still that like, well, we could lose them too, and then what do we do? So we've had to pivot to clinical experience, or simulation experiences and other kinds of ways to get our students to work in the areas that they need to.
That's cool. I know you mentioned that a little bit too in your first interview, and I wanted to ask you how if that's changed, because you mentioned that there's been a lot of loss of structure for your
Yeah,
students
yeah,
and even faculty.
yeah.
And is that continuing, or is there a little bit more structure now that we've had more time?
Well, I think what's happened. So we had the end of the one of fall, end of spring semester, where we had to do all this stuff, and then this semester that we just completed, fall, which I was able to then, I think I was able to restructure. So I think that's a good question, because we can't do what we used to do all the way. And then we were kind of like, what are we going to do? And this one, I was like, okay, I'm going to restructure it. And now this semester going forward into the spring, I feel like I do have more structure, and I figured out what worked previously and what's going to work now, and some other things I'm just going to let go of. And then we'll just see what happens. Again, we can make 3 different plans and we still don't know if that's going to work. So we have to, I think for me, and I think for many of our faculty too, we've just gotten better at, okay, we're ready. Just, sock it to me, see what happens.
Yeah, no, there's definitely been an increase in adaptive skills
That's a great
in
word. Yes.
everyone.
Yes. Very good.
So, the online alternatives that you're doing with your students who can't get into clinicals,
Mhm.
are you seeing that those are sufficiently preparing them in the skills that they need and the knowledge that they need?
Well, I teach mental health. And so my philosophy has always been they need to deal with live people, which can get really challenging. So one of the things I have learned and that I knew, is that many of the students are dealing with their own mental and emotional health issues, as well as those around them, whether it be, schoolmates or roommates but family. And so I've actually had my students do some of their activities or some of the process work with the people that are most accessible to them, which are usually their friends or family, and that's worked well. At least gives them a live person experience. I have last semester I had them look at a 75% completed simulation that was developed by a company, because we could get it for free. And so what I did is I had the students do that simulation, and then it got chopped off at 75%. And so the assignment was, okay, complete it. How would you complete this simulation? So it gave them, it was twofold. One was I wanted them to kind of take a look at this simulation product for me to let me know if they thought it would be good going forward. And secondly, to give them an opportunity to have them work on their own, like how would they do it? And it worked out well. Their feedback let me know that I would now, this coming semester, I'll be having my students purchase a simulation package from that company. because, the students said, yeah, we like this a lot. So I did that.
That's awesome. That's good to hear. I wonder, since there's less access to in-person clinicals, have there been opportunities for them to engage in telehealth?
Well, some, but because of the nature of the clinical sites that I go to, sometimes that's not available. I have really struggled with getting students into our psychiatric hospital here for some policy changes that happened way before COVID. So I just actually, before this, sent out an email saying, can we please have a conversation again? Our students do go to the VA and deal with, are in their either inpatient psychiatric unit or their outpatient mental health services, which does have a telehealth component. So I do know that some students have gotten involved with that. But a lot of the other places that we go to are like the Women's Recovery Unit, which is a 90-day drug and alcohol rehab program for women. So students are there, and that's thank God, is a live program. We can actually go to that. They go to some other locations that are not necessarily mental health, like they don't have a sign that says mental health here, but we know that almost 50% of the homeless population has undiagnosed mental illness issues. And so my students spend time at our Catholic Outreach Day Center that serves the homeless, the Soup Kitchen, Street Outreach Program, which is a program for homeless youth. And they also spend some time in hospice with social workers, chaplains, dealing with people in hospice. And then my students are also able to do some inpatient work at St. Mary's Hospital, which is our biggest acute care hospital, in the psychiatric evaluation team, spiritual care team, and with a social worker in the ER. So, my philosophy has been mental health issues are everywhere. So we go everywhere. And, I try to heighten the students' awareness of, okay, so they might not be saying, you've got a mental health problem, but is there an experience there with someone who may be experiencing some imbalance of some type?
Oh, that's really cool.
Yeah.
So what challenges have there been to maintaining social relationships that you've seen, and how are they being met?
Okay, who am I answering that for? Myself, my students?
For yourself.
World? Yeah, so I feel fortunate that I do have my job, my work here, because my work with the students is so all encompassing when, the semester's on. So that actually, I've been very thankful for the contact with the students, with the community partners, with my other faculty. I do have a married partner that, so at least I have that. And then my social life is a little bit tiny anyway when school's in. So I haven't really felt too much of a change, except for not being able to gather with people in like dinners or weekend, events and that kind of stuff, or visit family. So yeah, it's been somewhat shrunk.
What strategies do you use to cope with the social isolation and stress of the pandemic?
Yeah, well, for me, it's been a highly creative time. I found myself, I'm also a professional coach. And so I've actually really expanded my professional coaching opportunities, both with individuals and with groups. So I've been able to maintain quite the stream of coaching and consulting and teaching opportunities, even outside of my faculty work. So in that way, it's been highly productive.
Awesome. Have you heard of any other interesting coping strategies from coworkers or from students?
No, but I have really emphasized self-care, and that in nursing we throw around, oh yeah, we all got to do self-care, but I made it an assignment. So my students, I found a self-care package or program from somewhere, I don't remember where, that the students have to they have to do this assessment of what are you doing for self-care, and then they have to make a plan. They have to make an emergency plan, and then they have to do then they meet with me individually within the first 6 weeks, and I go over their self-care plan with them. And I'd say you need to do one of these things every day. I don't care if it's, you're going to drink a whole bottle of water, that counts. Or you're going to go for a walk with your dog, or you're going to go do yoga, or you're going to say a prayer. Every day you got to do something. And then at the end of the semester, they had to write a reflection paper. And if they weren't lying to me, the things that I read were, oh yeah, this was really good. I appreciate it. It made me really think about it. I did feel better. I did do more stuff, so yeah.
Yeah, that's really important. I think we hear a lot about the importance of self-care, but don't always know how to approach it. So
Oh,
that's a really cool assignment.
yeah.
I think I would find that especially helpful myself, even.
I'll send you the packet.
Thank you. I would appreciate that actually. Um, so another question I had based on your initial interview that I got to see was you talked about a fear that the stress of the pandemic is maybe driving away students from the field a little bit. And I just kind of wanted to follow up on that and see if that's something that you guys have seen, or if you've been able to, if students have kind of stuck in there.
Yeah, to be honest with you, I have been pleasantly surprised that students have hung in there. We have not seen an exodus of students out of our programs. We have seen a continued interest in applying to our program. So I think that's good. The ones that I'm concerned about, though, are the ones that are out there already. Like, we're seeing tons of burnout. We're seeing nurses, like read something on a Facebook post about a nurse. She's like, I've been in this job for 5 months. I just graduated 5 months ago. I got to get out because it's killing me. And I'm like, oh my God. So those are the ones I'm concerned about, who are out there now.
Now that we've been doing this for a while, um, what what changes to education have occurred that you think are going to stick around or are still needed?
Well, I think all of us who have not been online teachers are going to get stronger in that. I already have. I mean, I've been able to really use the online systems a lot more. So I think that that's been a positive. That's been a positive. I also do think that there's been a heightened appreciation of the value of face-to-face live teaching from both the student perspective and the teacher perspective. So I'm kind of hoping that when all this is over, we're going to have people going, yes, I want to go back to school. I mean, I can't wait for that to happen. So I think that'll be good. As far as other changes that are needed, I'm not sure. I just think that from a clinical perspective, is that maybe nursing schools need to work with their community partners a little bit more closely, using the same language around, we are looking at developing their workforce. We want to help them have an available, strong, skilled workforce. And the clinical partners, I would really love for them to be saying, yes, we want some of that action, so that we can have, recruitment streams and have strong staff because right now the way I see it is nursing schools are like, hey, we need clinical placements. Can you help us out? And they're like, we're too busy. And it's like, we don't have time for that. And it's like, see, there's a disconnect. So that's the change I would like to see is, strengthening those partnerships such that we are working for the same goal, which is to have highly skilled, highly competent workforce. And I think some of that is the nursing programs being able to talk to what is it you need so that we can make sure they're there. And these guys saying, what is it you need so we can help? But I also think from a clinical partnership perspective is that many nurse programs need some help with how to be a preceptor. Because we don't want we don't want you to just babysit the student for 8 hours, but how do you precept? How do you really get to be a teacher, in
Yeah.
your profession? So I don't know.
Cool. Speaking of working with the community, how do you currently see the community and health force working together at this time?
Yeah. Well, we're in Grand Junction. We're unique because we're a smaller population than Denver and other metro areas. So I think there is already, some of that community relationships that have already existed. So I think that's been good. I think CMU as a university has been very good with taking the leadership role and making sure we've created a safe place. We want to keep our students on campus, as much as possible. Our testing and tracing programs have been outstanding. We have to do these, check in with your green screen, before do you guys have that over there? You have to check in with your, like, I'm not infected, screen. So I think there's been a lot in that way. Our health department has, really stepped up and addressed things as well. So I think there has been definitely some collaboration and working together.
That's awesome. Speaking of like safety protocols, are the safety protocols clear for the community and for the schools on how to manage the COVID-19 exposure?
Sure. Well, I can speak mostly for Colorado Mesa University, and I think they are very clear. And I have the utmost of appreciation for our leadership here, our President Foster and his leadership team. Really great. The community, I think, has lagged a little bit, particularly with people that just don't think this is important. And because we are a rural area, with some very, and there's nothing wrong with being conservative, but I think there's also some uneducated people here that don't appreciate the science and the reality of this disease. So that's been very difficult, I think, from a community standpoint.
That's unfortunate.
Yeah.
So, knowing what you know now,
Mm-hmm.
is there anything that you wish you could have done differently?
I don't really think so. I mean, I just came up with so many. Probably the one thing I would do is not come up with so many ideas. It's like, all right, I'm really tired. I am really tired at the end of this semester because I created a whole bunch of things so that the students could have hours and experience and get as many live people encounters as possible. And it's like, I'm not doing that again. I will do what is needed, but I'm not going to be, I was telling the students, I was crawling on the ground, begging and pleading for you to get into that elder community so you could teach. I'm not doing it this time. And I created 10 mini teaching sessions for my students to go out and deliver. And I'm like, you know what? I'm not doing that. so yeah, there's one thing I learned is don't work so hard.
You already laid the groundwork, right? Which I'm sure
I
your
did.
students appreciate greatly.
They
But
do.
now it's time for you to get to take a step back.
And what was really cool, I appreciate you saying that, was really cool is that many of the students told me in either a card or a reflection that they really appreciated everything I had done to make the semester good, because my students that I had now in this semester, level 2, were in level 1 when it all started. They didn't even get any live people experience, none, because they don't even go to their clinicals until the last few weeks of the semester. Well, by then we were like, nobody can go anywhere. So they're like, oh my God, thank you for letting us talk to real people. So that's good.
That's really awesome.
Yeah.
They're lucky.
Yeah.
What would you say are the most important things that you've learned as a result of living through a pandemic?
Well, I think it's really pushed me out of my comfort zone with some of the virtual stuff, with the online teaching. So that's been good. And I also have been very grateful that if we were living in a pandemic in 1918 or 20, we wouldn't have all these things. Right. So I'm very thankful for that. And I think it's also pushed me to really, like I said, I've grown my coaching and consulting business quadrupled, because I have the capacity now and the level of comfort that, I could do a keynote for 300 people around the country. I did that. I can run a major training program for fast food managers in Northern California. I did that. So I've learned that, I've been able to develop these tools in service to, being with more people.
Wow, that's impressive.
Yeah.
All right. Well, is there anything that we haven't covered that you maybe wanted to talk about?
Well, I think that when we speak about the pandemic, I think we have another pandemic coming, or at least we're living in the midst of it, which is the mental health crisis. And it's the mental health crisis that for everyone, that is um, that is the result of isolation being one, because isolation's a killer, grief and loss, the dis, the kind of the disinformation, weirdness that's going on around what's true, what's not.
Right.
So I think there's a huge mental health crisis coming, or it's in our midst and will continue. And so that will be a challenge going forward. We're not done when this is done. We have another one to deal with.
Right. That's a good point. When something this big happens, there's bound to be ripple effects.
Big time.
Uh,
Yeah.
yeah. All right. Well, thank you so much for meeting with me and discussing all of this again.
You bet.